guys, so today I want to talk about aquagenic wrinkling of the palms. So this is actually a kind of rare condition that I've actually seen quite a bit online. I've diagnosed 3 cases so far, and it's pretty rewarding because typically the history almost always presents similarly. A patient usually complains of wrinkling of the palms with exposure to water. Sometimes they're able to take a picture and show exactly what it looks like, and then that just helps me make the diagnosis quite easily. So what is this? It's a pretty rare condition. It occurs in patients with cystic fibrosis. Sometimes it occurs in carriers of the cystic fibrosis gene, and it could arise in other medical conditions too. Typically, it's transient. There's also the hand in the bucket sign, which is exaggerated wrinkling of the fingers and palms when you're soaked in water for a prolonged period of time. It could be uncomfortable, sometimes presenting with pain or tingling, and sometimes it can be a little bit difficult to treat. It's related to sweating and is actually due to a salt imbalance in the skin cells, which results in increased retention of water in these cells, and that leads to increased transepidermal water loss. Some cases are medication related, such as due to aspirin and antibiotics, and possibly this is due to a drug-induced problem with the regulation of skin aquaporin. This is a protein that's responsible for water transport across the cell membrane. So how do you treat it? It's a little bit difficult to treat. It doesn't have really great treatment, especially because this tends to be a chronic condition that people live with for a prolonged period of time. But typically I tend to use antiperspirants such as aluminum chloride in the beginning, like Drysol, and sometimes oral antihistamines like Benadryl to reduce itching, and sometimes Botox injections, which could be done by your dermatologist, and hopefully you can get it authorized by your insurance company so it's not too expensive, but of course it's a bunch of injections and needles, which nobody likes. It's diagnosed clinically by physical findings, and typically it's an easy diagnosis to make with the worsening of a exaggerated wrinkling with prolonged exposure to water and a bath or even a pool. And sometimes it has little translucent papules or whitish patches that coalesce into plaques. And typically it's more common on the hands. I've never seen it on the feet. They say the feet are not affected. So that's it. Aquagenic wrinkling of the palms.